Welcome to the Getting Healthier Together module on managing pain. This video can help you understand what chronic pain is, explain your pain to others effectively, participate as a partner with your healthcare team, learn about healthy living strategies, and create an action plan for yourself. What is chronic pain? With all the information you read and hear, it can be hard to separate the facts from the myths. A myth is a common belief that is not true. Here's an example. Take a moment to decide if you believe this statement is true or only a myth. Doctors and nurses who care for you are the experts about how much pain you feel. This is a myth. The fact is that the person who feels the pain is the expert. What about this statement? There is no reason for you to feel pain when no physical cause has been diagnosed. This is also a myth. The fact is that since the study of pain is relatively new, many of the causes of pain that people feel are still unknown. Here's another common belief. Take a moment to decide if it's true or only a myth. Pain builds character, and the best way to deal with it is to be strong. This is another myth. The fact is that pain that isn't managed can have a very negative impact on a person's quality of life, and it's important to seek medical attention for any new or ongoing pain. How about this statement? You'll get addicted if you take pain medicines. Is this true or a myth? This is a myth. The fact is that while becoming addicted to pain medicine is a common fear, you can reduce the risks by discussing your concerns with your healthcare team and taking medicines as prescribed. Here's the last statement for you to consider. Pain medicine will eventually stop working, and the doctor will keep increasing the dose. Truth or myth? This is also a myth. The fact is that when pain is managed well, the dose can often stay the same or even be lowered. There's a handout available to you called Common Myths About Pain. You can use it as a reminder about the facts. Now that you've separated some common myths from the facts, let's take a moment to talk about the differences between acute and chronic pain. To understand the differences, think about a fire alarm. Acute pain is like a fire alarm that is working very well. It signals danger and alerts you when there's a real fire. Chronic pain is like a broken fire alarm. It rings loudly all of the time, falsely signaling danger when there is no threat of a fire. Acute pain lasts less than 3 months. Chronic pain lasts 3 months or longer. When chronic pain isn't managed well, it can have a very large impact on all aspects of your life. The good news is that when chronic pain is managed using a combination of strategies, the pain doesn't have to dominate your life. You can regain control and see hope for the future despite ongoing pain. In Part 2, we'll be talking about ways to explain your pain to others. How can you explain your pain effectively? Have you ever felt uncomfortable trying to explain your pain to your doctor or other members of your pain management team? Has it been difficult to provide all the details you wanted to share? We have a set of 10 tips that might make these conversations easier. The first tip is to be prepared. Bring your pain records with you to your appointment so your pain management team member can focus on what is important. The second tip is to be ready to talk about your pain and answer questions. You're the only person who can best describe your pain history and what your pain is doing to your life. The third tip is to plan to discuss how your current pain management plan is working. You may be asked if you have any side effects to medicines, if the pain is less intense, and if the pain feels different than before. The fourth tip is to have your questions written down so they're ready for you to ask. The fifth tip is to be prepared to listen actively by giving your full attention and verifying that you are understanding what you're hearing. It may help to bring someone with you to record information so you can listen without worrying about remembering everything. Do ask in advance if you may record your conversation. What do you suppose you might say if you feel that your healthcare provider is rushed, doesn't seem to be listening, doesn't provide enough information, or doesn't provide enough time to talk? Could you say, "I know you have limited time to talk. Since I have several questions, do you have time now?" Or could you say, "Do you have another way of communicating with me before my next appointment?" Or could you say, "Who can answer my questions if you're not in your office?" Or would it not be appropriate to say any of these things? Take a moment to think about your answer. All of these would be appropriate things to say so that you and your healthcare provider can make a plan together. The sixth tip is to try to be clear and concise. Writing down information ahead of time may help you be able to tell your story in more detail. The seventh tip is to be your own advocate. Be confident. Speak up about information you don't understand. Take an active role in creating your pain management plan. The eighth tip is to be open and honest about any concerns you may have about pain medicines or other treatments. This helps build a partnership with your pain management team member. The ninth tip is to keep in mind that pain is an emotional experience as well as a physical one. And finally, the 10th tip is to identify one person on your pain management team who you trust to oversee all aspects of your pain management plan. There's a handout called 10 Tips for Explaining Your Pain that's available to you. It can remind you how to make your conversations with your pain management team as productive as possible. There's another handout available to you called Be Prepared for Your Appointment, and it looks like this. It has 2 parts. The questions on the left are samples of what you might want to ask at your medical appointment. If you want, pause this video for a few moments so you can read the questions. Or you can keep going and read them later on your own copy of the handout. There are also questions on the right side. These are questions you might want to be prepared to answer during your appointment. Again, you can pause this video for a few moments if you want time to read these questions. Or you can keep going and read them later on your copy of the handout. There's also a handout available to you called My Pain Tracker. This form can help you keep track of how your pain medicines and other ways to relieve pain are working. You can make copies of the blank form so you can reuse it whenever you want. To use the form, write an X on the pictures to mark any areas where you're feeling pain. There's a section for your personal goals. There's a place for how you want to feel on a scale of 1 to 10 when you're resting, and another place for how you want to feel when you're doing a specific activity, such as walking your dog, also on a scale of 1 to 10. A goal of 1 would be to experience no pain. When you fill in the form, circle your own goals and write in your own specific activity. Fill in the medicines you're taking and any other pain relief methods you're using in the spaces provided. Then, circle your current level of pain at the time that you're filling in the form. A 0 would indicate no pain at all, and a 10 would indicate the worst pain possible. Filling out a form like this and bringing it to your appointments can be an excellent way of sharing and explaining information. In Part 3, we'll be sharing some ideas for how you can be an effective partner as you work with your pain management team. Being an effective and active partner with your healthcare team starts with understanding what you should expect from the team and what they can expect from you. Take a look at this list of rights. Be treated with respect and compassion. Be listened to and taken seriously. Have your pain and medicine history taken. Have a complete evaluation of how your pain impacts your daily life. Question, ask for explanations. Change your mind or disagree. Have information communicated in a way you can understand. Discuss all pain management treatment options. Be involved in developing a pain management plan. Know the risks, benefits, and side effects of each treatment. Have ongoing follow-ups and make changes to the plan as necessary. And seek a second opinion or request a pain specialist. Take a moment to answer this question. Are all of these rights that you have as a patient? If your answer is yes, you're correct. Pain is real. These are your rights as a patient. Now take a look at this list of things that you're being asked to do by your pain management team. Be honest, open, and not defensive. Speak up and communicate. Measure your pain by using a pain rating system. Work with them to establish the plan. Follow your plan for an adequate amount of time. Discuss different treatment options with them. Follow rules or procedures. Tell them about any concerns you have about taking pain medicine. Notify them about side effects. And tell them if your pain isn't lessening. Take a moment to answer this question. Does your pain management team have the right to expect that you will do these things? The answer is yes. Your pain management team has the right to expect that you will do all of these things so that they can help you manage your pain in the best ways possible. Now that you have a good idea about what you can expect, let's explore ways for managing pain. There's a handout called Different Methods for Managing Pain that's available to you, and it provides a brief overview of some methods for managing pain. There's no need to memorize what's on the handout, but it can help you understand recommendations you may hear about from your healthcare professionals. The general pain management categories are distraction, such as music or reading, rehabilitation, such as physical therapy, psychological therapies, such as psychotherapy and hypnosis, invasive interventional options, such as surgically implanted devices, cutaneous technique, which is a technique that affects the skin, such as applying heat or cold or massage, and complementary therapies such as chiropractic or osteopathic medicine and yoga. There's another handout available to you called Sample Tracking Logs. You can use the sample logs to create your own, so you can keep a history of your pain medicine prescriptions and your methods for relieving pain without medicine. When you keep this information up to date, it can help you communicate with your pain management team at each office visit. In Part 4, we'll present some healthy living strategies that can help you manage your pain. There are several strategies that can help you manage your pain, and we're about to explore 5 of them. The first strategy is to get the right amount of physical activity for you. Exercise is considered an essential part of managing chronic pain. Pain can worsen if you're out of shape and can increase your risk for injury. Regular physical activity can tone and strengthen your muscles and boost bone strength. It can increase your flexibility and help joints work better. It can help you build stamina, improve your balance and mobility, and help prevent falls. Physical activity can help you maintain your weight or lose weight if that's appropriate for you. It can help increase your energy level, help you sleep better, and lift your mood and feelings of well-being. It's important that you discuss the best physical activities for your specific pain condition with your doctor before you start an exercise program. The second healthy living strategy is to get the nutrition that's proper for you. Eating a healthy diet can help with weight loss, which can improve pain in weight-bearing joints. Good nutrition can improve blood sugar levels, reduce heart disease risk, help your digestion, and increase your energy level. The third strategy is to reduce your level of stress. This can help you feel more confident and in control and decrease pain. Being relaxed can help decrease anxiety and depression. Living with chronic pain can be stressful and life-altering. Do you suppose that stress can affect your level of pain? Take a moment to think about this question. The answer is yes. When you have more stress, your pain can feel worse to you. Regaining control of your life can help lower your stress, reduce your anxiety and depression, and put you back in charge of your life. The fourth strategy is to get enough sleep. This can help you cope better with the impact pain has on your life. Difficulty sleeping and excessive daytime sleepiness are common problems. When pain interferes with adequate sleep, chronic pain gets worse. Unrelenting pain is exhausting, and sleep deprivation can have significant negative effects on your emotions, physical health, and ability to think clearly. Getting a good night's sleep is a very important goal. The final strategy we'll talk about here is to include social support in your life. Socializing with others can bring you a smile, make you laugh, and help you enjoy life. It can help you be connected to others and distract you from your pain. Others can share your burden of pain and validate your experience. Tell friends and family what you're feeling and how they can help you. Reaching out to others is one of the most important strategies to help you cope. In Part 5, we'll explain how you can use a personalized action plan for managing pain. An action plan is like a roadmap. It turns the decisions you make about what you want for yourself into practical steps for getting where you want to go. There's an action plan for managing pain handout that's available to you, and it looks like this. You'd begin using the plan by reading through each of the choices to see which ones might interest you most. The choices on the action plan are organized into sections including take an active role, see the whole picture, set realistic goals, get moving, let go of unhealthy habits, and improve your support system. The idea is to choose the action items that you want to do. You can also write in your own goals in the other section of the handout. You may be tempted to check off a lot of the boxes in the list, but it's better to start off with just 1 or 2. Lifestyle changes are made one step at a time. If you're overwhelmed with too many changes at once, you're less likely to reach your goals. You can always add more goals later as you continue making changes that move you towards the better and healthier life you want. When you're finished making your choice, there are 4 questions for you to ask yourself based on what you selected. You've already answered the first question, which is, what behavior would I like to change, based on which checkboxes you've selected. The second question to ask yourself is whether you believe that it's possible for you to do the things you've selected. Answer with a yes or no. The third question to ask yourself is, what must I do to achieve this change? Make sure that you identify a specific action that goes with what you want to change. For example, if you choose that you want to make sure to get enough sleep, decide how many hours of sleep that means. Write your method for measuring whether you've reached your goal in the space provided on the action plan. Deciding how you'll measure your success is a very important part of this process. The fourth question is, when will I make these changes? Think about how long you think it'll take you to make this change in your life, then write the date for when that'll be in the space provided. The last step for creating your personalized action plan is to select your confidence level for making the change you've decided to make. To do this, select a number from 1 to 10 for how confident you feel that you'll follow your action plan. A confidence level of 10 would be the most confident, and a 1 would be the least confident. If your level of confidence is lower than 7, think about choosing something else on the action plan, or maybe giving yourself a little more time to make the change. There's one final handout that's available to you, and it's called Managing Pain, What You Need to Know. The handout has a summary of the key points from this video, and we hope it'll be useful to you. Thank you for your time and for participating in Getting Healthier Together.